Welcome to our Learn Community Education webinar today. I'm Dee Childers with Life Changes Elder Care Consulting and Vice President for Learn, as well as the Community Education Chair. And our topic today is Shed Light on Your Pain. And I am very excited to hear our presenter today. First, a little bit about Learn. Learn stands for Lifelong Education and Aging Resource Network. We're an Idaho-based nonprofit organization with a mission to provide community education on aging and caregiving topics. And Learn is part of the Leaders Network, which is part of the Society for Certified Senior Advisors. And the Certified Senior Advisors is an organization that educates and certifies professionals who work with seniors. The content today, general disclaimer, is provided for general informational purposes only and is not to be considered legal, financial, or health advice. Please consult with your professionals in these categories before taking action based on this information. Peggy Farnworth is a retirement financial advisor as well as retirement coach. And then we have Granny on the Move, who act as general contractors for service seniors who can no longer live at home independently. And you see the websites for both of our sponsors right here on the screen. These folks are what allow us to be able to bring this information to you free of charge by helping us maintain our infrastructure and services. So thank you very much to these not only sponsors, but members of Learn, professional members of Learn. And today our speaker is Sharon Kotsky from the LLLT. Sharon's been a very good friend of mine for very many years, and I have been so pleased and impressed and excited about the LLLT and what red light therapy can do that I was just tickled when Sharon agreed to be our presenter today, because this is very key and timely information. It's nice when we have avenues to help address our pain without having to take medication.
Welcome to our discussion on shining the light on chronic pain. My name is Sharon Kotsky. I am the president and founder of Photonic Healing, which offers both the Wisdom Light and the LLLT. I am a board certified light therapist, a certified equine red light therapist, a certified sound healer, and I have degrees in both industrial engineering and construction management. So when you put all that together, this is what you get. I'm joining you from sunny southern Idaho, and I know that you're from all over the United States. So I'm very pleased that you're joining us for this discussion. And I understand that we weren't able to let everybody in. So if you're enjoying the replay, welcome. I appreciate that. So today I want to share with you something that is so old, going way back to the Egyptians, that it's actually new again. And that is what is called light therapy. Or more recently, it is being called Photobiomodulation, which is kind of a mouthful. So we call it PBM for short. And the reason the industry has been moving away from the long used but kind of confusing term of LLLT. It's either low-level laser therapy or low-level light therapy, and hence the confusion. To photobiomodulation is that it more accurately explains the therapy. Photo is light, bio is cells in the body, and modulation is the interaction between the photons and the cells, specifically with the cytochrome deoxidase, which are within the mitochondria. So PBM is the application of applying lights of specific wavelengths to the body. And this starts a cellular reaction that reduces pain and inflammation, increases circulation, and stimulates cellular repair. You're going to hear me repeat that again over and over because that's the main core to all of photobiomodulation. It's not surgical or thermal, and it's rather a photochemical effect. So whereby the light is absorbed, it exerts a chemical change. Now, outside of the battery, the light source does not create any heat. So although people feel an increased circulation, they can feel warm, that might confuse people. but the PBM device itself should never put out any heat or get hot. So what is an LED? LED stands for light emitting diode. And this was discovered by NASA to promote plant health and growth in space. And it was accidentally discovered that it works on promoting wound healing. So in space, the astronauts, they're all, working around, and you don't heal in space because gravity isn't there to help you heal. So some of the astronauts' hands were healing, the nicks and stuff that they would get on their hands were healing, and other ones weren't. And they're like, what are you doing that I'm not doing? And they said, well, I'm tending to the plants. And as their hands were going underneath the red lights, it was healing all these nicks and cuts on their hands. And so that's what got this whole thing started. And if you're interested in learning more about that whole story, the link that we have on the slide, and if you're interested, we'll put that in the chat as well, goes into talking about this. And I find it very interesting that, some things that are discovered by accident can become your best friend. So we get asked a lot about, how does the FDA fit into all of this? And in 2019, the FDA came out with this guidance document, and you can read the entire thing at the link, and you're welcome to put that in our chat as well if somebody is interested in looking at that. And it's called the General Wellness Policy for Low Risk Devices. And this is intended to clarify where they stand on LEDs. And we are just that. So per the FDA, a general wellness product, one, has to have an intended use that relates to maintaining or encouraging a general state of health or a healthy activity, or has to have an intended use that relates the role of healthy lifestyle with helping to reduce the risk or impact of certain chronic diseases or conditions, and where it is well understood and accepted that healthy lifestyle choices may play an important role in health outcomes for the disease or condition. Doesn't that just sound like the government? So what is considered a low risk device? Well, LEDs are considered to be a low risk device as they are non-coherent light, as opposed to a coherent light like a laser. And that means that the wavelengths are not all commingled into one, and they actually, they span out. But what the FDA is saying, that to be considered a low risk device, first of all, it has to be non-invasive. Next, it has to not be implanted. And third, it can have no safety risk, like a laser. So what they're saying is if you fall into this category, you will no longer be evaluated by the FDA. So they will not take your device and examine it and give you the clearance that they used to do. And they won't even actually take them. So LEDs are all considered deemed safe by the FDA. But what's the difference between that and a laser? Well, when people hear about, words like light therapy, they usually think about laser. And laser stands for light amplification by the stimulated emission of radiation. Sounds like a lot. But because of that, the FDA does not consider them to be low risk. And lasers, boy, they range in power from very, very low, little pointer pens that we use for our presentations, they're very benign, all the way to something that you can have as a surgical instrument. And so when somebody tells me that they have a laser, literally, that doesn't give me enough information. It's like saying I drive a car. All I know now is you're going down the road on 4 wheels instead of 2. There's just too much outside of that. LEDs aren't like that. They're very straightforward, very clean. LEDs, the properties of an LED, as we mentioned before, are non-coherent. Let me get this, there we go. They can, because they're non-coherent, they'll influence a larger area. They're considered a low-risk device by the FDA. They're safe and non-invasive. And generally, they are less expensive per milliwatt. as opposed to a laser that does have a coherent light that shoots that beam all the way and it goes forever. It creates a very small spot size, and it's not considered to be a low risk device, and it must be evaluated by the FDA. They can pose safety concerns depending on the class of lasers, and they're always generally more expensive per milliwatt. So when NASA discovered that the healing properties of LEDs, the world was introduced to a non-invasive, safe, and drug-free alternative to cellular regeneration, or more commonly referred to as healing. So I've been working with LEDs for over 20 years, and we've always had to address the misconception that lasers are better than LEDs, okay? Even though we know they are not. And so it's really encouraging to me to see some of our top researchers change their mind and come out and actually bless the LEDs. Dr. Hamblin of Harvard Research and others have changed their mindset about LEDs. And recently they published, this is just one of the studies that they have published about the efficacy of LEDs, and that their conclusion is basically LEDs are here to stay. Now, laser people don't want to hear that. But basically, the bottom line is that researchers are recognizing that the body responds to a photon the same regardless of the source. The body does not know if that photon came from an LED or from a laser. Now, if you need to do some kind of a surgical procedure or get a tattoo removed, you're going to need a laser. Otherwise, LEDs are safer and less expensive with amazing results for both people and our furry friends. And we're going to show you some of those in just a minute. So as I mentioned before, the benefits of PBM are it lowers pain, it reduces inflammation, it improves your lymphatic drainage, it increases circulation, and it stimulates cellular repair. So if you think about it, what can't that help? What would reducing inflammation and increasing your circulation not help? Just about everything. So lights can be your best friend. The most common colors of photobiomodulation in the past have been red, near infrared, blue, and green. Most of the research PBM has been the red, the 660 nanometer. But then they discovered how infrared releases some of the stuck nitric oxide, and that opened up a whole other area of interest and research. Now, infrared's not visible to the eye, and it starts in around the 700 range, and it goes well up over 1,000 nanometers. And so there's a big range there. We work in the lower, in what we call the near infrared, which is in the 800 range. But not too far behind in research is the blue wavelength, and that starts around 405 and ends around 480 nanometers. And the newest research, and this is going to happen to me right now, is in the power of the green. And when I talk about green, I start releasing without even having my lights on, and it's happening right now. I'm trying to hold it back, but I love the green, and they're finding it's phenomenal, and it releases 10 times the oxygen that the red light does. So pain and all kinds of things are going on with the green. Each wavelength penetrates the skin to a different to a different depth. And that's why we use different colors, because there's different healing properties that it's affecting as it's going through these different layers. Now, the longer the wavelength, the deeper the skin penetration. So of course the infrared is the deepest, and it will go in about 100 millimeters, which is about up to 3 inches, a fair amount. Now, we talked about these colors of the PBM being infrared, red, blue, and green. And I put this chart together to kind of help identify what area of concern somebody is looking at, what color they would want, and what that will do for them. So red and infrared go together a lot. And in fact, you can add infrared in with any other color, and you can't go really wrong with that. But it's great for increasing your circulation, releasing the nitric oxide levels. Now, blue is on the opposite side of the spectrum. And so blue is a soothing light. Blue is antibacterial and antifungal. So it's awesome to have when you have a wound healing. It's kind of my Neosporin. But anytime you get an injury, when you hurt yourself or you do something and you think, oh, I need to put some ice on that, whether it's a burn or a fresh boom or whatever, blue is like having ice in a light. It will stop the process. And we'll show you some pictures of that in a minute. And then green. Green is a phenomenal color. We used to think that it was just for calming and anti-anxiety and grounding us, but the researchers have now jumped on the green bandwagon and they are finding it's awesome for migraines. It's great for pain relief. It's great for skin pigmentation. So green in itself has a lot of its very great benefits. But I want to introduce you to a new concept. And that is what I call polychromatic light. Okay, so when we start combining the colors of these, and we add the blue and the red, and we add the green and the blue, and we add the different colors, we get the slide of combining colors for PBM. The concept of polychromatic wavelengths is really not new, but mostly it has been about combining red with infrared. And I want to introduce what I think is polychromatic light. And that is when you combine two colors of light, you actually see a third color. Okay, so when we combine the wavelengths and we've got red in one and we got blue in another, the cones in our eyes average them. And that's the color that is sent to the brain. So if you have blue and you have green, the brain sees turquoise and sends turquoise to your body. Now, to me, when I start thinking about turquoise, in my mind, I think about me being on a beach with the waves and the ocean, and I'm very calm and I'm very relaxed and very soothing. It's also, I think about the jewelry that people wear. It's very spiritual. So turquoise sends up all these signals into my brain that start processing outside of the colors on the body. So to me, you get the two colors that are on the body and a third color that the brain sees, and you get this 1-2 punch by doing that. And you get the benefits of all three of these wavelengths by doing this. And so they're starting to study these different colors. You know, if you go back in the 70s, they had done some studying on the different colors and it kind of fell off. And now they're starting to look at it again. And I'm really excited about it. We use turquoise on our vagus nerve a lot to put us in a parasympathetic state. Other people use red. I happen to like the turquoise combination. So let's talk about pain though. And let me ask you a couple of things. How much of your daily life activities have you altered to work around your pain? Let's think about that for a second. What are you not doing anymore because it hurts? You know, are you still enjoying the daily activities that you love the most? You know, those long walks that you like to do, or maybe you participate in more physically demanding activities, but your body just isn't keeping up with you like it used to. You know, are you sleeping well, or do you toss and turn just trying to find that comfortable spot? Well, are you maybe even more irritable than normal, and you don't, are you feeling depressed and you don't even understand why? I had a lady call me last week. Her grandma won't get out of bed, and it's because she's in so much pain and she's just kind of decided that she doesn't want to deal with it. Well, we can help that person a lot, and we're going to talk about that. So pain itself is a disruptive event. You know, whether that is a surgery, an injury, a wound, maybe you tore your tissues or you broke a bone, all of that creates less cellular respiration. And what is cellular respiration? It's the process through which cells combine oxygen with food and they create your, I have a hardest time with this word, adenosine Nope. Adenosine triphosphate. I like to just say ATP because I stumble on that word and I've been saying it for 20 years and I still have a hard time with that one. Probably my engineering, I mean. But this, pain either becomes an acute or a chronic condition. Acute, you hurt yourself, you get over it, and you get back into your life. Chronic, it becomes part of your life. Chronic pain actually sets up into the frontal cortex of your brain, and we're going to talk about that in just a second too. But we use light, which is different colors of wavelength, and sound, which we're going to get to in a minute, which is pulse light at certain frequencies. You can use these together to promote healing and reduce pain. So the lady on the right, who's holding her back like that, I went through a couple of weeks of that not too long ago, when my SI joint flares up. Or getting up off the floor. The older we get, the harder that gets to be. I mean, can you relate to this? And maybe you can relate to the next one, which is not feeling real well. You're cranky, you're irritable, you're not sleeping well. All of those are signs of chronic pain. So chronic pain itself, and we're not going to talk much about acute pain because we can get over acute pain pretty quick, but chronic pain is pain that lasts, 3 to 6 months. So chronic pain is pain that lasts, 3 to 6 months. There's not like a magic, oh, you hit this, you're out this far from your injury, now you're into chronic pain. Chronic pain is stuff that just isn't going to go away. And the longer you have it, the more it causes the peripheral nerves to become oversensitive, overreactive, and the location of pain perception changes to the prefrontal cortex, where the cognitive and emotional components influence pain perception. So chronic pain can really settle in the brain, and it affects more than just the area of pain. It affects the entire body and even those around you. And it can create a personality change. And here's a heads up, it's not usually a pleasant personality change. If you've been around people that have been in chronic pain for a while, you know it. So how about this? How would you like to be this young man? He was in at the time that I met him, he was in his early 20s, and he told me he hadn't touched his toes in years. He couldn't remember the last time he touched his toes. He's a tall young man. And after a very short time of working with him on his lower back with the lights, look what he was able to do. And he was very, very happy. But how would you feel if you were that young and you were already having to accommodate for your pain? Outside of pain, we want to really talk about the lymphatic drainage that we need to have working, because healthy lymphatic flow is essential to removing inflammation from the body. Inflammation equals pain. That connection's always there. We actually take it one step further than that. Inflammation in the gut is inflammation in the body, and that equals pain. And if that's an interest to you, there's a summit that we're going to be doing coming up that's free, and there's a link in there for that too. But we're really starting to study the connection between the gut and the body and pain, and how all that comes together as well. So a few years ago, I was doing a show, and this lady came to me, and her hand was that in the very left. It was just all bulging like that. And I said, we need to work on that. And she said, I don't have any time. I got to go watch this set. It was a cutting show. I said, I won't take long. I'll be fast. So I got my red light, my blue light out, and I was just working on that hand as much as I possibly could in the amount of time that she gave me. And then she left. And about 15 minutes later, I could see out of the corner of my eye, somebody come flying out of the stand, running towards my booth. She slapped her hand down on my table, and that's the middle picture. She said, Sharon, look at this. People in the stands, I get goosebumps when I think about this. This is so profound. People in the stands are telling me they can see that hand shrink. And then she continued to use the light, and a couple of days later, she sent me a picture, and she was all healed. I do believe she got an infection from having surgery. I think that was what that little incision on the right picture is about. That's just one of the kinds of things that we get. This is a friend of mine. I believe she said she ran into the coffee table. I don't know about you. I've never done that, right? And within 20 minutes, she had that goose egg down. That's the blue light. That's what I'm talking about. It can stop the process that quickly. And some of us, we don't have ice with us when we're out and about, but we can always carry a light. And we're going to go through the stimulating the cellular repair. Some of these images are graphic. The first one is not. The first one, I want to share with you, it was, like I mentioned earlier, it was NASA that discovered that by accident, that the lights can promote wound healing. So, what about this? Have you ever had a wound, surgery, broke your bone? All of these will heal much, much faster with the addition of light therapy. And so now I'm going to share with you some before and after photos. Some of them are graphic, and you may or may not want to look at these. I will certainly let you know when it's safe to return. This one's not bad. This lady had a surgery on her face, and you can see after 1 week, and then after a couple, I don't even know what the time difference was between week 2 and today, but she's got absolutely no scar. And some people, scars on their faces is a big deal. So she was it was important to her to not have one when she got done with her surgery.
So Sharon, how long are you shining the light on a wound like this each day? How long and how many times to get it to where it was week 2?
That's a great question. I like to do it at least twice a day when you have something fresh and you have access to it. Sometimes your wounds have dressings on them and you can only get to them, every other day. But as often as you can, for like up to about 5 minutes, it doesn't take very long, especially with working on that. She's just going to work on this little incision right here. Each wound takes a little bit of different amount of time depending on how bad it is. And we're going to show some different ones as well. You want to do it as often as you can, and the more often you do it, the faster you're going to see results. Like this is my cat. Now, he showed up with this big old lump, and then it turned to a black spot, and then it became a hole. And I'm pretty sure it was a brown recluse bite because that's kind of how they act. And it was a Friday. And it's like, what am I going to do about this? The vet automatically. They're going to keep him for the weekend. They're going to try and stitch that. They're going to put him on antibiotics. They're going to, this is just not the route I want to go. So I picked him up like a baby and shined that light on his throat twice a day for 5 minutes each time. And within a week, that hole was closed. He's never been to the vet, and he is absolutely fine to this day. We talked about surgery. That's my knee. And you can see that in the picture on the right, the scar is very fine. It's not big, thick, and purple. And you'll see all these little rings on my skin. I always say, look for the rings. When I place the light on the skin, I never push. And so when I take it off and there's a ring, that came from the body because it certainly didn't come from the light. That is the inflammation that it's taking out. And you can just literally see it go as you're working on an area like this. So when you're getting rings, you're in the right spot. And this particular one is a friend of mine's horse. It was a 3-month-old foal, and they think it was stepped on. It's a back leg. And you can see in the picture on the left on day 1, the bone showing and a black spot on that bone, which is a bruise to the bone. Took it into the vet, and the vet said, this horse needs to be put down. It's 3 months old. It's a back leg. It's never going to be right. It's going to have a bad scar. It's going to have tissue issues. It's going to have all kinds of problems. It was a performance horse really needing those back legs to be working. And they decided that that's not what they wanted to do. And so you can see after 1 month of treating that leg looked great. And after they finished treating it, there is the smallest little tiny scar on the leg. And that's it. Never was lame, never became ornery. Sometimes if you're doctoring an animal and it bothers them, it stings, it hurts, you're only going to get it done once. You got a horse with a back leg and you're down there on the ground trying to doctor this horse. Well, it could have been a bad situation very, very easily, and it wasn't. But aren't these crazy photos? I mean, to me, you're probably thinking, how can even light do this? You know, and the answer is really quite simple. Light is a nutrient that our body needs, and it's absorbed into the cells. So it increases the circulation, decreases inflammation, and stimulates cellular repair. And it sounds complicated, but really it's not if you think about it. You know, I know that I feel better when I get some fresh air and sunlight, and I can start feeling grumpy and blah when I don't. Bottom line, the body needs light. But when you take light and sound and you combine them, you have results that can catapult. I'm just going to mention these really quickly. We're not going to get into sound frequencies very much here, but we work a lot with the Nogier frequencies. I personally like them. There's 7, and each of those resonate with the cellular structure in the body. The Solfeggio, there used to be 6 frequencies, now there's 9, and those are more for emotional healing through chanting, the Buddhist monks, that you'll hear that. Fibonacci is a mathematical sequence that follows the rule each number is equal to the sum of the preceding 2 numbers. So it creates the spiral pattern. And if you start paying attention in nature, you'll see it. You'll see it in flowers, you'll see it in seashells, you'll see it just in nature in different ways, in pine cones. You'll see the pattern. And then there's a Rife machine. A lot of people are more familiar with the Rife machine. It uses hundreds of targeted frequencies to promote healing. And then the Schumann resonance is an extremely low frequency, and it can be as low as about 8 hertz. It's 7.88 right in there. And it's said to be the Earth's frequency. So if you want to get plugged into the Earth, that's the frequency that you want. But as I mentioned in the beginning, light therapy is so old that it's new again. And with that being said, there are so many tools on the market to select from, and it can really be overwhelming to try to decide what you need, because not all LED therapy tools are the same. You know, more research is calling for a multi-wave approach. In 2018, Peter Gwynn and Maurice Gallagher from the School of Biology in Edinburgh, the United Kingdom, published a paper titled Light as a Broad Spectrum Antimicrobial. And they basically concluded that to maximize efficacy, a realistic light-based therapy system seems likely to require use of multiple wavelengths with several distinct targets. So you're going to want to go through this little list of checklist when you're looking for products. You know, there's a lot on Amazon. I can tell you right now, none of them come with customer support. I am involved in so many different Facebook groups where people get on there and they want advice on how to use their Amazon product. Well, I'm not going to get it probably from me. So your takeaways from this, though, is that photobiomodulation is the industry term that you're going to want to pay attention to. It's replacing LLLT. And it's been scientifically proven with over 6,500 research articles. That particular link is another one if somebody's really interested in research and really wants to get into the nitty-gritty. Oh my gosh, you can get lost in that database. We credit Vladimir he's another one I'm going to have a hard time. Helsinki from Helsinki, Finland, for putting this database together. It's got, like I said, over 6,500 articles right now. Every day there is about 100 new articles being published. That's how fast this industry is really, really growing. We've learned that they're safe and effective. You could see the result. I could spend an hour or two just showing you before and after pictures, but I think you got the picture. You get the idea there. It's very easy to learn. A lot of times it's a matter of turn it on and put it where it hurts, kind of a thing. Or you can take it as involved as you want and start learning about, you know, different combinations and following your charts and doing all kinds of things with photopuncture. You can do it with just using it in the area of concern. So there's a lot of different tools that are out there. It's excellent to combine with your other modalities. I have a horse right now that we are really trying to get to the bottom of. So she's getting chiropractic work. She's getting PEMF work. She's getting light therapy. And before anybody touches that horse, I give her a light therapy session. So then her muscles and her bones are ready to receive any kind of adjustment that's coming at her. It's a great addition for health and wellness for you, for a professional. To me, you can't go wrong with having lights in your pocket. It's harder to do if you are trying to carry a first aid kit or anything like that. The lights slip with you, they go with you anywhere that you want to go. So I know that I'm introduced as the light lady, but 2 years ago, we introduced the Vism light as well. And so this is the contact information for us for the Vism light. You can reach the light the same place as all of these. We are on Facebook, LinkedIn, not really so much on Twitter, Instagram, YouTube. Please follow us on our YouTube channels if you're interested in getting our newest videos that we do. And of course, that's our website. And I really want to thank you for taking the time, you know, to listen to this discussion. We're going to take questions. I'll see if there's any in there. But let me ask you, you know, I have a special thank you that I want to share with you, and that is to offer you a discount on both the all lights and the Vism light. It's only until the 7th of September, so take advantage of it now. But, you know, I want to ask you one more time. I asked you this when we got started. What does your life look like? Are you enjoying everything that you want to enjoy? Are you playing with your kids and grandkids? Are you doing the activities that you really, really enjoy? Or have they taken a backseat to some of your pain and injuries? You know, you deserve to have the best life that you can have. So don't you think it's time?
So Sharon, would you be open to entertaining questions?
Absolutely.
I have a few from the chat, starting with the first one we received. How do you use green to address sleep disturbances and blue to address fever and inflammation?
Well, green, we actually have a little protocol that we do for light, for the green. And you've got your third eye, you've got your emergency point, and the heart chakra. Those are your 3 points, putting it in the palm of your hand. Now, the Vism light, when I turn the Vism light on for green, this is going to make me start yawning and doing different things. So fair warning. I just take it and I put it in my hand like that. Here it comes. It's that fast for me. Okay, so that's how, and then of course I have 2 of them. So at night I'll just take them and I'll put them in the palm and I go to sleep. And they shut off in 10 minutes. So I don't worry about that particular one. So that's how I use the green. Blue for fever. Was that the question? Blue for fever?
Blue for, I'm looking, at fever and inflammation, correct?
Well, you could use it in a couple different ways. You can follow charts for fever, and those are acupoints. And instead of using the red light on them, I would use the blue. And when it comes to inflammation, we put it right on the spot, you know, wherever, like that lady that had the big goose egg on her leg, right on it. And I think she didn't even do it for 20 minutes because those pictures were 20 minutes apart. So she probably did it for 5 minutes and let the body absorb that and process it. So what was another one?
Is it safe to use with cancer?
So there's a lot of discussion about cancer and the lights. All of us have cancer cells in us, right? If it was going to promote cancer, we'd be in a world of hurt because we'd all be walking around just growing cancer in us. They are finding that it's very effective against some cancer, especially the side effects. If you're into chemotherapy, the sores you get in the mouth and different things like that. Anytime that you're getting injected, you want to put it there. Your energy levels. Would you put it on an active tumor? Maybe not. That's up to kind of you and your comfort zone. I personally would, because I know that it resonates with healthy cells. It does not resonate with unhealthy cells. And so when it resonates with the healthy cells, it promotes those cells to become more active, and they're going to do what they need to do. There's a couple studies out there, and I can find just as many studies that will negate that. So it kind of comes down to a comfort level as far as I'm concerned. I personally am comfortable using it, but I'm not going to tell somebody else that that's what they need to do. And that just is kind of everything. So
Okay, next question. How do you know when you should use PEMF versus the AS light?
versus the all light.
All light. Oh, yes, it must be. It says AS light, but I'm guessing the all
For
light.
the children this evening,
So they're different technologies, and I'm not a PEMF expert, okay? I just have a lady that comes and uses that in conjunction with the lights. And so I don't have a PEMF machine or pads or any kind of a setup that way. So I don't use them myself. I just utilize other people that will do that. And like I said, I'm not an expert on the pulsed electromagnetic frequency at
Okay.
all.
Another question for you. Can you describe the difference between the two lights? Also, how to actually use two colors at the same time, both at the same area or something else? Question mark.
So I'm guessing they mean the two lights being the all light and the Vism light.
That's what I guessed too. Yeah.
So the all light we've had for about 10 years, and they start out with red, and then we had the blue, and the neat thing about them is that the heads will interchange. Then we added the green, and then we added the big PBM light, which has got red and infrared. So you can imagine, if you're a doctor and you're running around with this in your hands, that's not as conducive. So I was asked, will you put those in one light? There's where my little engineering brain starts again. I'm like, yeah, not only can I put them in a light, I want to add sound frequencies and other features to this. So the price point on these two lights is very different. This is more involved and sophisticated, and some training is required. We do a 30-minute with you as soon as you get your light to help you get going with this. It's got a 10-minute timer on it. These are on for forever. I've driven over this with my car. I've dropped this on the floor and it broke. Durable, intended to be used in the barn. You know, these started when I was only working with horses, because 10 years ago, the FDA didn't have the position that it has right now on lights and what we could say and what we could share. We're still very limited. It does way more than what we can share, but they're both rechargeable, battery operated lights. Both use LEDs, both use the same frequencies. This is a 660, this is a 660. This is a 410, there's a 410 in here. This is a 530, there's a 530 in here. There's an 810 in this one, there's an 810 in here. So we have the same light wavelengths in this light, and we just put them all in one and added the sound and added the other features that go with that. So that I hopefully answered that.
Is there any electrical considerations when working with the Vism, i.e. pacemaker or a client in an electrical wheelchair?
No. Now, I don't think I would put it right on that pacemaker, especially if you're going to start using some of the frequencies. If you're just using the red all light, you're probably fine with that. But an electric wheelchair, no. There's no problem with that.
What color for dry eyes?
They're doing some really neat things right now for dry eyes. And the macular degeneration that we're getting, they're using red and infrared.
Okay. Question, do you ship your devices to Canada?
We do ship them to Canada and all over the world. We have a huge presence in Brazil right now. This is really exciting. There's somebody down there found us and we are shipping to Brazil like crazy. There's a big research center for light therapy down there as well.
Can I use the green light for sleep similar to how you use the Vism?
Absolutely. Absolutely.
So again, Sharon, those 3 places.
Let me shut this off. Ringer mute. I thought I ringer muted. Stop. Oops. Sorry. I got everything else fixed. I got my cell phone shut off. Anyway. Yes, in fact, the green light is all we had when I came up with the protocol. Put it here, put it here, put it here, put it in the palm of your hand, on your chest. I personally like the green light on my heart chakra. I find it to be very calming and very soothing. I really I resonate very well with the green. Green is good for your heart.
Are there pads that can be used to place on our pets and let sit there for the 5 minutes?
There are pads. And we right now offer another company's pads, but in about 2 months, we will have our own. So hold out because what's coming is exciting. Very, very exciting. Very, very exciting. So hold off on getting pads for just a little bit and stay in touch with us on that one.
So how big will the pads be, Sharon?
They're gonna, oh, Kimberly, can you shut your... We can see your
I muted her.
okay, great.
How big are the
The
pads?
pads are going to be different sizes. So there's one that's going to be able to go around your waist. There's going to be a long skinny ones. There's going to be ones that fit the horse's heads, the horse's feet. There's going to be different size squares, going to be small ones so we can put them on our lymphatic system very easily. We can make any shape that we want. That's very exciting. And they will have red, blue, green, and infrared, and they will have pulsing and non-pulsing and other things too. So, and they're flexible. Right now, a lot of the pads that are out there are thick and stiff and have them little knobbies that come out, and you aren't going to want to lay on. I can't even put those on my knee. My knee is too hypersensitive from the chronic pain that I've had for 5 years after my surgery to be able to place a pad that's got the little knobbies on it. A flat flush pad, one that bends around the body. That's what's coming. So anyway, sorry, didn't mean to get off track. Got me excited.
That's okay. Next question we have is a 15-year-old spinal disc injury is completely limiting me. What would work for old injuries?
A couple of things. I am a big firm believer in somebody getting myofascia work done. And when you have an old injury like that, your fascia is messed up. And so before I go, that's what helped me. When I couldn't walk for the last 2 weeks, I put the lights on, then I go get my myofascia work done, and then I put the lights on again as soon as I come out, and it just settled all of that down. I have at least 30-year-old injury in my back, and that I've injured twice since then. And so I understand some of that stuff is become part of us. And I was walking around like this. Well, between the lights and getting some myofascia work done, I've had 3 sessions with her and I feel really pretty good. So I am a big believer in combining modalities. I don't think one is going to get you everything that you need.
Okay. Next question for you. Dee, do you want me to keep going with the questions or do you want to take them over?
No,
Oh, I see. I
please.
kind of see where you're at. Linda's. Okay.
I'm here.
You want to
Go
just
ahead.
take them here?
So Linda, no, the rhythm is not absolutely redundant because we now have the sound frequencies in here. And you can combine the colors a lot easier. Let me show you really quick here. Here's blue, right? I don't know if you can see that. I can add green. This doesn't show up very well on here, but what my eye sees is turquoise. That's harder to do with the all lights. I mean, you can put them both and shine them on the same spot, and you got a spot that you're working with about this big. This is a bigger light. I love it for lymphatic release. It's easier. It's giving me a bigger area. And we can now add the Nogier frequencies, which is really a big deal as well, because now they're going to resonate with all of your cellular structures. Can you use this on the eyes? Yes. In fact, because it's an LED and not a laser, they're using these at the University of Wisconsin. In fact, they're using the all lights. They're studying macular degeneration and different things. And there are studies coming out now to help you with your farsightedness when you need the glasses to read. Yeah. But you got to be consistent, and it's not going to like happen overnight. The longer you've had the issue and the more deep it is in the body, the longer it's going to take to resolve itself. The lights are like putting a jumper cable on a dead battery, and it says, come back and heal. You forgot. You gave up. And so it just restarts that again. And the body wants to heal. We all know the body's phenomenal for that. But we get in the way. We don't give it the help that it needs. And then the other one I love is when people are like, well, I use the lights, but it didn't help. Well, you got to stop playing basketball for a couple of days while you're doing that. You know, you need to help it as much as you can. So does it work with receding gums in the mouth? I don't know. I don't know the answer to that. Why are the gums receding? Dean, do you want to add to this at all?
So one of the things that I know just from working with you is that oftentimes that using the lights on acupuncture points are key targets. Could you talk about that a second?
So yes, and that was one of the big intentions of the all light was to work with acupoints. And then the bigger the lights, it's harder to do that. And so what we've done with the Vism light is I designed a sleeve that fits over these. Show you really quick. When you turn the red on, you only get one. Now you can work with acupoints as well with the Vism light. So acupoints are based on traditional Chinese medicine, and they're the same points that an acupuncturist uses with needles, but you don't have the needles. And you can use the light on each of those points for a brief, 15 seconds, some say up to 30 seconds. It kind of depends on the size of the light, the accuracy of the person, and their skill level. If you're not sure where the acupoint is here, and you put the light here and you're not right on it, after 30 seconds, the light's going to filter down and find it. It's going to go through and find it. The more accurate you are, the less amount of time you need to spend on an acupoint. But combining the acupoints with the direct healing, we call that our indirect healing, our direct healing. You can do anything. You can work on any condition, and that gets into the stuff that we can't really get to directly. Fever. Fever's a great one to use acupoints for. So which light? Oh, go ahead, sorry, Dee.
Was that somebody else that was going to ask a question?
I was just reading off the questions in chat.
Oh, okay. Well, one of the other questions that I had is you talk about work with the lymphatic system and the benefits. So to facilitate the lymph drainage, do you need to shine the light, hold the light over what the lymph system primarily is, or the key lymph drainage points, or is that just as an outcome of using the lights?
No, we actually target the pockets of lymph and some acupoints that are known to control the lymph system, like triple heater 5. And so we've got charts for that. But I personally like, and that's why I like using the two lights, whether you have pads or you've got lights or something. I start at the neck, I get I get combo with the lymphatics and the parasympathetic at that point. Then I go to my armpits, then I do my groin, and I do the back of my knee. And so I do about 2 minutes. If you had one light, it'd be two, it would be twice as long. And that's another reason for having 2 lights, is you can cut down your time. Plus I've got 2 hands and I'm ADD, so I've got to be going. That's just who I am. So somebody asked which light works on deep bone pain. Infrared, any infrared. So you can, this has got infrared in it. The 3 inner diodes are infrared. And this has infrared in it. Oops, I guess you got it over here. So you're going to want to use infrared for anything that is more than 8 to 10 millimeters into the body. And deep bone pain would be that. So what color for thyroid? And can light be directly on thyroid? My belief is yes, you absolutely can put it on there, and I use blue. This is also your throat chakra. We're not going to get into the chakras and talking about chakras a lot, but if you've got a presentation that you feel like you have a conversation you're going to have with somebody and you don't feel like it's going to be a comfortable one for you, put the blue on your throat before you go. That's going to open up that chakra for you as well. But yes, it can totally be. Other people use red. There isn't one way to do things. And that's something, if you take one takeaway from this, it's that you can't do this wrong. You can do it better. You can find, one day I might be wanting green and the next day I might be wanting red. There's nothing wrong with that. Your body's also going to help you understand which ones that you are wanting. So what colors would I use for equine? Uveitis flare-ups and right over the eyelid or someplace else. Blue. And we actually have some testimonials from people that were using the blue. I do it right over the eyelid, right over where it is. And instead of shining it directly this way, I might shine it this way at the eye, you know, or let the eyelid go down and go over the top of that. Because the horse is not really sure what to do about closing that eye like a person would. So you can help with that. We've got a lot of questions of color for dog kidney failure and placement of where the lights to go. Well, that's a great one for a no-J frequency for kidneys. I'd put it on that. You're going to support the general wellness with your red light. I would probably use red and infrared on the kidney itself, but you might want to try green, depending on how flared up that is. So, like I said, there's just not one. I've had a really hard time coming up with protocols, and this is why, because there isn't one way to do this. And as the body responds, you need to adjust the time and the frequency, the duration, you know, where you're putting it. Well, thank you, Lachelle. I appreciate that. Yep. There is not one cure. Post-dental work using the F frequency. Well, F frequency as in F down here, or F frequency as in the actual no-GA frequency F, which is for emotional reactions. So I'm thinking you mean the F here, and which of the no-GA frequencies you would use, and what dental work are you? Fillings, root canals, TMJ, what is the dental work? But you absolutely can use it with anything. And yes, it would when you ask, will it help? Would reducing inflammation, increasing circulation, and stimulating cellular repair help? If the answer is yes, your answer there is also yes. But I think you're talking about that, you know, using one of the no-GA frequencies. And yeah, absolutely. Oh, Dean. I think Dean came back. It's hard to say, possibly infection or possibly osteoporosis. And I don't remember the original part of the question. Was it about? You might have to get back to him. Did you get that, Dee?
I did not. Can you speak a little louder? The iPhone or the phone that's speaking from 727?
Is that Dean? hard to say. Maybe,
Receding gums is what he was saying,
oh, he
referring
was
to.
receding gums. Oh, possibly from the infection or pus. Yeah, I mean, you want to get rid of the cause, but if you want to reduce this, I would use the red. I would actually use red on all of my gums. Is it true that someone can buy a light device for their own home? Yes, you can. In fact, that's what we encourage people to do, especially COVID. During COVID, oh, we were so busy during COVID because people couldn't get into their doctors, and yet they still had issues and they still needed to take care of their health. And so this was the great tool to use for doing that. Oh, root canal and filling, yeah. Both blue and red can help with that. Okay, I'm not a medical person. I guess I should have said that up front. So dystonia, I'm not familiar with that condition. Maybe you can be seeing guns. We've talked about F frequency for bone reconstruction. Yes. Yes, Annabella. Okay. Did we get to the bottom of them? Okay.
Yeah.
Is
Okay.
there any that we haven't gotten to? I hope you learned something. I hope this was helpful. Nightmares. What do you mean? Oh, what does it help do for nightmares? What's causing your nightmares, Linda?
Linda, you're on mute.
Oh, well,
There you are, Linda.
about everything. Bag lady, homeless, fears, being lost, nobody to help, strange city, lost.
Well, anxiety to me is green. And green's my go-to for any time I'm feeling a little,
Mhm.
I don't even need to have it turned on and I react to the green light. That's how strong I resonate with this particular color.
Okay.
And then somebody asked, skin allergies on a dog. Absolutely. The red light on the allergy on our acupoints will help with that a lot. New message. Let's see. Help with, I'm guessing, cataracts. Yeah, it can. Again, the key is you have to be consistent and know that it's going to take a while. So nothing is outside of the acute pain. It's not a one and done. It's a tool you add into your life and makes everything better. And then it has the combination effect of the more you use it, the less you actually have to use it. That makes sense? All righty, well.
So maybe just, I see numbers are popping up, just a couple more questions, and then we're gonna need to end our session today.
Absolutely get off opioids. That is the biggest reason for using the lights, is that you can maintain pain without opioids. If the person wants to get off opioids, absolutely. My challenge is that I've run into people that really don't want to get off of opioids. They might say they do, but when you start really working with them, you're like, this is your comfort zone. This is where you want to be. I can't get a person out of that if they don't want to come out of that. But absolutely, this is a great replacement for opioids. 2 years ago, we had a big conference in, I think it was in Washington, D.C. Just exactly this. PBM instead of opioids. And is there a maximum time to spend on an area? There is a point of diminishing returns. And so a lot of sessions are 20 minutes. I've done 3 sessions at one time, so up to an hour, but I don't think I would go over that, because your body needs to take that in, and it can only drink it in so much and so fast at one time. And so you can, you don't want to go, we say go low and slow. And here's another thing. I get people that come to me and they've got layers of stuff. They've got issues here and issues here, and they've got been told they have fibromyalgia and they've got this and they've got that. Start slow. Pick one. Put your body into parasympathetic state. Get the lymph to move, and then address the area of concern one of them at a time. Your body, if you try to deal with everything at the same time, your body will go and try to detox all of that out, and you won't feel so good the next day. And you'll be like, Sharon, I'm not your friend anymore. And I don't want that. I want everybody to be my friend because I'm here to help. So how many days in a row is okay? You can do this every day. You won't necessarily need to. After probably the first 30 days, you'll start, tailoring it down. But you can do it. It's a great thing to do as part of your health and wellness. And the more you can do it, the better you're going to get results. All righty. I think we've wrapped a lot of those questions up.
Excellent.
Okay.
Well, Sharon, thank you so very much for your time today. It has been very educational, very helpful in taking kind of a technical subject and bringing it to a place that is pretty easy to understand. So I thank you for that. Also, the grounding in where the therapy comes from and seeing how it can help heal and reduce pain from NASA is also validating, kind of similarly to the PEMF modality, which they've built into the spacesuits for the folks that go in, the astronauts, and just making some of these more technical, what seem technical and kind of overwhelming modalities very reasonable, very common sense. And I know just as a personal testimony for Sharon, as I was coming home from a long drive from my father's up in the Tri-Cities area, and I had a hitch in my giddy up that was something that I could barely sit still. And Sharon used to live out in Middleton, and I called her and said, can I come by for a light treatment? And it was quite amazing. Within about 5-10 minutes, my pain had been managed and I was able to get back on the road and finish the trip home. So sometimes it feels like a little bit of magic, but I know it's science-based, and I appreciate that very much. And you've done a great job of helping us understand that. So I thank you for that, Sharon.
Well, we don't want to get too far into that science base because everybody would be dropping off like flies.
Right. So you did just enough, and you certainly gave us access to a database with 6,500 studies out there. So we can go do our own additional research if we'd like. We have had handouts put in the handout section of our Learn website, and they will contain some of these same copies of these slides that have these URLs on them, so that if you didn't catch it in the chat, you can catch them from the handout section. And maybe, Sharon, what we might want to do is just even create just a simple one-pager with all the URLs on it, and then we could put that in the handout section too. So
Do you want to copy that slide? That would work.
That would work. We can do that. Absolutely.
Mm-hmm.
So I thank you again, Sharon, very much for your expertise, your technology knowledge, and all of the tools and resources that you've added to your website. So there are books to kind of how-to user guides out there, not only for people, but for horses or animals that you can access. And I find resources very helpful. I'd like to thank our sponsors once again for making this presentation possible for us to present to you free of charge. Peggy Farnworth, the retirement coach, as well as Granny on the Move. And if you would like to receive, you will be receiving an email once the video is ready to be is posted on our website. You'll also get an invitation to join our mailing list if you'd like to join any of our other live webinars that we do as a part of our commitment to providing free education to the community. So you do need to confirm your subscription. We don't just add you to our list. And if you don't see it in the next 2 to 3 days, check your junk folder. Could be in the junk folder, as well as the notification to come watch this webinar, the repeats of it.
Can I say something real quick?
You bet.
If you're not already on our mailing list, if you didn't join us through our mailing list and you would like to be on our mailing list, by all means, jump on either one of our websites, and there's all kinds of places that you can sign up to be on the newsletter. And that would be the best way to hear from us when those pads are going to be ready, because that's exciting stuff happening in no time.
Excellent. Good point, Sharon. The emailing list I was talking to was about Learn, but as we know, Sharon has extensive mailing list as covered by the number of participants that we've had on our webinar. I think, Sharon, you are the all-time high
Thank you.
registered participants as well as attendees of a live session. So if there's a prize for it, I'm giving it to you. In fact, dinner's on me next time we get together.
Oh, well, hey, we'll make that happen. But it just really makes me feel good to know that there's an interest and that I can help people.
Excellent. Thank you, Sharon.
Okay, thank you, everybody.
Our next event will be September 8th, discussing the future with aging parents, and then signs of a scam. And soon we will have our next quarter workshops out. If you find the webinars that we present here on Learn as helpful and useful, and you need a place to share some of your money, we would love to be considered as a donation location for you. We are a 501c3 nonprofit, so you can go to learnidaho.org donations to make a donation. And with that, I thank you all, and we'll look forward to seeing you at our next Learn session. Have a great day and a happy Labor Day.
Enjoy, everybody. Thank you.